Hello, everyone, and welcome to the first Friends of NCCN Foundation Supporter Forum. My name is Wendy Reese, and I'm the Grant Specialist at the NCCN Foundation. We are so excited you have joined us for the next hour and a half. We miss being able to meet with you in person, but are thankful to have this time with you today via webinar. There is a full agenda, and we have a lot to share with you. I would now like to introduce our speakers for today. The first topic, NCCN and COVID-19, will be presented by Dr. Bob Carlson. Dr. Carlson is the Chief Executive Officer at the National Comprehensive Cancer Network, NCCN. Dr. Carlson joined NCCN as CEO in 2013, following a long history of leadership positions within the organization, including Chair of the Breast Cancer Guidelines Panel and Chair of the Survivorship Guidelines Panel. Marcy Reeder will then give an update on the NCCN Foundation and our patient resources. Marcy is the Executive Director of NCCN Foundation, a role she has held since 2013. Dottie Sheed will illuminate the NCCN Guidelines for Patients development process. Dottie joined NCCN in 2000 and currently serves as Director of Patient Information Operations, supervising the development and publication of the NCCN Guidelines for Patients. Dr. Weijing Ko is the Senior Vice President, Chief Medical Officer at NCCN. Dr. Ko oversees the NCCN Oncology Research Program and the NCCN Clinical Guidelines in Oncology. Prior to joining NCCN in 2018, Dr. Ko served as Professor of Radiation Oncology at the University of Washington and Medical Director for Radiation Oncology at Fred Hutchinson Cancer Research Center, Seattle Cancer Care Alliance. Dr. Ko will present on the NCCN Foundation Young Investigator Awards program. Closing remarks will be given by Gary Waymiller, Executive Vice President and Chief Operating Officer at NCCN. Gary joined NCCN in 2014. We thank all of our speakers for taking part in this event. Before we get started, I would like to remind everyone that we have allowed time at the end for any questions you might have. Please send questions as you think of them through the Q&A at the bottom of your screen. And now I will hand it over to Dr. Bob Carlson for our first presentation. Thank you so much.
Thank you, Wendy, and welcome everyone to our first supporter of the NCCN Foundation session. I'm going to start by providing a brief background in terms of NCCN, and then talk about some of NCCN's response to the COVID pandemic. So the NCCN is an alliance of leading cancer centers devoted to patient care, research, and education. And as a non-for-profit, we are strictly mission-driven, and our mission is to improve and facilitate quality, effective, efficient, and accessible cancer care so that patients can live better lives. This shows the NCCN member institutions. We added 2 new member institutions this last March, the University of Texas Southwestern Simmons Comprehensive Cancer Center and the UCLA Johnson Comprehensive Cancer Center. So the NCCN is now an alliance of 30 leading academic cancer centers in the United States. We are viewed as an arbiter of high-quality cancer care. We develop and communicate scientific evaluative information to better inform the decision-making process between patients and physicians. We also develop and promote national programs to facilitate the fulfillment of member institution missions. And again, as mission-driven ourselves, we strive to improve and facilitate quality, effective, efficient, and accessible cancer care. Core to the NCCN's products and services is a library of 77 clinical practice guidelines. The 77 guidelines feature 201 algorithms, and they cover over 97% of all cancers that occur in the United States. This number of guidelines continues to increase, and you can expect to see probably 3 new guidelines per year at least over the next few years. The NCCN Guidelines are recognized as the standard of clinical policy in cancer care in the United States. They represent the most thoroughly and most frequently updated clinical practice guidelines available in any area of medicine globally. They are widely available free of charge for non-commercial use, and over 11 million copies of our guidelines were downloaded last year. The guidelines also serve as the basis for insurance coverage policy and quality evaluation in the United States. Now, if I was giving this presentation 4 months ago, we would be transitioning to talk more and more about specific aspects of the NCCN Clinical Practice Guidelines. But the COVID pandemic has really forced NCCN to pivot on a dime to address the challenging issues of cancer care within the COVID-19 pandemic. In response to this, the NCCN very quickly put a web page on our website that's found at nccn.org/COVID-19 to provide resources to the cancer community to face or deal with the threat of COVID-19 in the cancer space. The webpage provides a forum for sharing best practices and specific ways that our member institutions have responded. We also very quickly posted guideline recommendations for how to prioritize cancer care according to the guidelines in the midst of a pandemic. There was a huge drain on resources, a diversion of resources from cancer care to COVID care, and that made availability of key resources for cancer care like operating rooms, diagnostic CT scanners, and so forth much more limited, and really forced cancer care to change. We also had concerns, as others did, about the protection of patients from COVID-19, because we know that cancer patients, while they may be slightly more likely to get COVID-19, have much worse outcomes than patients without cancer. The guideline panels put up data or recommendations that, again, that cover treatment, they cover issues of prioritizing screening, early detection, and supportive care. And this website is maintained by NCCN under the great leadership of our NCCN Best Practices Committee. We also have some formal publications. These publications primarily came out of the NCCN Best Practices Committee. The first was on managing cancer care during the COVID-19 pandemic and focused on agility and collaboration toward a common goal. How do you organize the systems to deliver cancer care within a COVID-19 pandemic? This manuscript came out of the University of Washington, Seattle, and where they were one of the early areas in the United States to have to deal with the pandemic. This was record-breaking in terms of our JNCCN speed. This article was accepted, was received, peer-reviewed, accepted, and posted on the JNCCN website in only about 4 or 5 days time. There's a follow-up manuscript that also talks about delivering care safely within the COVID-19 pandemic, specifically how to keep our oncology patients, but also our healthcare workers safe as they deliver care in the midst of a pandemic. We have also hosted a series of webinar series. There have been 3 primarily done to date. The first was in the auspices, again, of our NCCN Best Practices Committee, and it was to create strategies implemented during COVID-19 that will impact the future of cancer care. Extraordinarily well attended and incredibly high quality presentations. NCCN also worked jointly with the American Cancer Society in 2 different webinar series. The first webinar series was focused specifically on professional cancer care teams, and the second webinar series was specifically focused on non-professional cancer care givers. This was one of our few, but hopefully just the start of collaborations with the American Cancer Society in our educational programs. The Best Practices Committee also has started issuing a series of best practices insight reports. And the June 2020 issue is focused specifically on COVID-19. And it focuses on methods of staff communication within the COVID-19 pandemic, workforce support and resiliency, and the challenges and best practices of working from home during the pandemic. This insight report is available free of charge on our website. You can see it there under nccn.org/store. Looking forward within the COVID pandemic, there is a potential for a long-term impact of COVID-19 on cancer patients and on our healthcare teams. Oncology care in the United States is not going to be back to the old normal, probably ever, as we move forward. Some of the challenges of cancer care within the COVID-19 pandemic have been the postponement of treatment of patients who are known to have cancer and are under active treatment. And that postponement, again, was because of diversion of resources away from cancer care to COVID-19 control, as well as the concerns about exposure of patients under treatment to COVID-19 infections. Not only are patients under active treatment, however, having their care delayed, but we are seeing very low new patient volume within our cancer centers. It's not that COVID has made cancer go away, it's that patients are delaying the initiation of their diagnosis and treatment. And as a result, we are seeing patients that are being diagnosed with more advanced disease, and we are anticipating that this will result in future excess deaths. The excess in deaths was recently the subject of a report that came out of the National Cancer Institute. And what this shows is the excess deaths expected as a result of the COVID-19 pandemic in patients with colorectal cancer and with breast cancer. And as can be seen, between now and 2030, almost 10,000 patients, there will be almost 10,000 excess deaths of colorectal and breast cancer patients in the United States alone. I find this very sobering because it tells us that while the death rate from COVID infections directly is exceedingly high, there is a very large number of deaths from non-COVID related infections specifically that will be associated as a result of the COVID-19 pandemic. And this will be a huge challenge for our cancer centers and the oncology community just in general as we try to catch up with these patients to try to minimize the number of excess deaths that will occur. Of course, the COVID pandemic is also happening at another difficult time in our society where the disparities in cancer care, specifically based on racial composition of our society is being highlighted. We do know from the COVID-19 experience that there are huge racial disparities in COVID-19 infection rates, in the frequency of testing, and that racial minorities, especially Blacks, have outcomes of care that are far inferior to those of other racial and ethnic groups. We also know that Black Americans have the highest death rate among all American racial groups and the shortest survival of any racial and ethnic group in the United States for the vast majority of cancers. We also know that Black patients are greatly underrepresented in oncology trials, and that makes it difficult for us to understand the importance of race and ethnic origin in terms of optimizing cancer care. We also know that Black individuals receive guideline concordant cancer care at a much lower rate than non-Hispanic white Americans. We also know that guideline concordant care in the United States is associated with greatly improved overall outcomes, specifically survival relative to guideline non-concordant or discordant care. There have also been studies that show that if Black Americans are treated with guideline concordant care, that the disparity in outcomes is truly minimized and often disappears in comparison with non-Hispanic white Americans. So we have to do better. We have to do better in terms of COVID-19 care. we have to do better in terms of cancer care for our racial minority Americans. So with that, I'd like to thank you all for participating in this WebEx again. The NCCN Foundation is celebrating its 10-year anniversary this year, and it continues to be very active in supporting patients and their families that are affected with the cancer diagnosis. And it continues to provide funding, as you'll hear, for some of the nation's top next-generation cancer researchers, guiding the course of cancer treatment and innovation and advancement. So thank you all. I'm sure that you are on this webinar because you have been important in the success of the foundation and in the support of the foundation, just as the NCCN staff and others have been. So thank you very much for your hard work and your support in those efforts. And with that, I will hand it over to Marcy Reeder, the Executive Director of our foundation. Marcy.
Thanks, Bob. Thank you for everyone attending today. It's so great to see so many familiar names on the attendee list. So I'm so glad you could join with us. I'm going to go over some updates about the NCCN Foundation. As most of you know, our mission is through the philanthropic support that comes into the NCCN Foundation. We try to empower people through knowledge and really support the mission of NCCN to facilitate quality, effective, efficient, and accessible cancer care. And it's really about patients, and so patients can live better lives. The philanthropy, the donations that come into the foundation support a number of different things. Biggest category being the NCCN Guidelines for patients. Those are the patient-friendly adaptations of the clinical practice guidelines brought down to a level that patients and caregivers and families can truly understand, read, digest, and help aid them in their care. We have a full library of patient guideline books, which I'm going to cover in just a minute. We also provide patient webinars for families dealing with a cancer diagnosis, and it's to educate them about information that's in the patient guideline book. We also are looking at doing some patient education animations. We have some in the works. They're coming hopefully before the end of the year to highlight some of the information in the books in an animated fashion, which might help people understand some complex things that are inside of the patient guideline book, and also direct them then to the full book for more information. We've been very successful with language translations of the patient guidelines through the support of many that are on the that are with us today. And we also support distribution of the patient guideline materials and the other things that we have to offer through webinars and things. And then we also support the app with the patient guidelines. So we have a downloadable app, which I will talk about soon as well. We also support the NCCN Young Investigator Award program, and we have Dr. Ko today to talk to us about that a little later. And support also goes to general NCCN mission support. So it's very important that we keep moving forward and supporting all of these programs. So the NCCN Guidelines for Patients, they are to empower families. They're to empower patients. And again, patients are the center of what these are designed to do. And it's to help put patients and providers on the same page. If you give patients and families an easily understandable version of what physicians are using to determine care, it puts everyone on the same page. It gives everybody the same information. And this is important because not all patients are getting standard of care depending on where they're treated. And we know 70 to 80% of patients are being treated at community centers, and it may not be a subspecialist in their type of cancer. So this really ensures that patients know, no matter where they're treated, what the gold standard of care is and what the recommendations are for their care by the dream team of docs that focus on their specific cancer. We want to ensure that patients are aware of all of their care choices, all of their options for treatment, and these deliver that. And it also allows patients to advocate for their own best care. There's a section in the patient guidelines that has lots of questions that patients can ask their care team to make sure that they're having their questions answered and that they truly understand, their path forward. So over the years that the foundation has been in existence since 2010, we've done, I believe, a very good job of building the library of cancer types. We had a goal to make sure that by 2020, we wanted to make sure 90% or more of patients diagnosed in the United States had a patient guideline appropriate for their diagnosis. And we've been successful doing that. You can see here, we're actually at 95% now, covering 95% of patients diagnosed with their cancer type. And you can see how many books. I think we're on 46 right now, soon to be 47 different books available to patients and families, with the goal that we'll definitely post a bunch of new patient guidelines before the end of the year, and then it'll continue into next year. Currently, the NCCN Guidelines for Patients library consists of many, many different cancer types, and you can see them on this list. It's also important that we are looking at non-tumor specific guidelines. So there are a whole series of guidelines on the clinical side that help with not specifically a cancer, but definitely cancer topics that are important to be addressed. And so far, we do have several in that area. We have for distress and nausea vomiting, lung cancer screening, and one specifically for adolescents and young adults. We've also responded to the need around the world and in the U.S. for language translations. And we've been a bit reactive just when there's opportunity there and there's a want for a language translation, we will help make that happen. And you can see that we've translated many of our patient guidelines into other languages. Some of the most highly used international translations, believe it or not, is in Russia. They are high users of the patient guidelines at this point and really appreciate having that information in their language. New in 2020 and 2021, we have some guidelines for patients that are coming. The NCCN put out their very first pediatric clinical practice guidelines in the last year or so. So we are starting to then adapt some of those pediatric cancer guidelines into patient format. So you'll see pediatric ALL is coming, which is incredibly exciting. And also a whole bunch of different cancers that are either already posted or they will post this or next year. And then you can see there's a bunch of supportive care ones coming. Most notably, we just posted our immunotherapy side effect management patient guidelines, which we've had a lot of great feedback and excitement that those were able to be posted. And then we have a series coming in survivorship, and that definitely is very much welcomed, and we've been waiting to do that for a while. So we're happy to say that that's going to post this year. There's one for general survivorship and one for late and long-term side effects. And then you can see there's some more language translations coming as well that we're currently working on with the NCCN Global team. So we currently provide 4, like I said, non-tumor specific books, and I've already listed those. But just putting the word out there for all of our current supporters and potential supporters that we would love to add more non-tumor specific supportive care guidelines that would be really important to patients and the patient advocacy organizations that we work with. So there's many more that we need to add, and they're listed here on this slide as well. So the books can be accessed in multiple different ways. They are available online, and they're on the nccn.org/patients website. And they're free to access. On the clinical side of our website, you have to register with your username and password to access the clinical guidelines. But on the patient side of our website, you don't need to do that. It's direct access to the patient guidelines. They are viewable in a PDF download. You can save that on your computer or device. And our counterparts in our business development department with NCCN have been very active in trying to get additional support for free distribution of print copies. So when you look at a patient guideline, it will say if there's free print copy available, and you can click and then order one or more patient guidelines to be sent to your home in print copy. So that's really exciting. They do tend to go quickly, so if you see that they're available, jump on right away and place your order, because they do go quick and they are limited in supply. Also, on a mobile device, it could be a tablet or a cell phone, there is an app. It's the NCCN Patient Guides app. And once you download that app, you can download all of the patient guidelines. They will live in the app once you download. Any updates that come will be pushed out, and they're accessed that way. It's also really exciting that we just added the patient guidelines into the clinical guideline app. So all the providers that are using the app to look at the clinical practice guidelines, all of the patient guidelines are in that app as well, to help with our distribution to patients. And then, like I said, print copy is available in limited numbers through NCCN, but also we continue to get requests for print copies from individuals, and maybe we don't have free print copy available, but they can still get a print copy if they want one. They're available all on Amazon.com, and people can go there for a nominal fee and order their patient guideline to be sent to their house, and they are included in Prime. This is a little bit of information on our user survey, and from January to December in 2019, we had almost 14 million online page views of our patient guidelines by almost 1 million unique visitors. So that was incredibly great to see that we've continued to increase over time the number of people that are accessing the patient guidelines. And over the years that we've done this survey, the statistics have not changed very much. It's about 2/3 patients filling out the survey, and a handful of caregivers as well, and then healthcare providers make up the rest. The consistency in their feedback has continued all of these years. The patients find them very understandable, very informative, and very helpful, and it has increased communication between patient and provider and helped make treatment decisions. Patients have reported this, and so it's been so nice to see that our outcomes from our patient guidelines continue to be at a very high level and show that they are continuing to be very helpful. I told you I would tell you a little bit more about our patient guideline webinars. So we have a series of webinars available on our website in archive format, and we also post when we're going to do the live webinar. So what happens is we'll run a live webinar twice, and then we record and put it in archive format for further viewing. They're all available through our website. It pops up. You can watch it in the YouTube format. You can watch the entire webinar, the education webinar, or we've actually split them down into topics. So if there's a certain topic you want to listen to or see a certain question answered, you can go on and do that specifically. And the webinars go about 70 minutes. We have a panel of experts, usually a panel member on the NCCN Guideline panel, a nurse educator, and one of our patient advocates to help present the information to patients. And then anybody that registers for the webinar also has the option to get a free printed copy of the patient guidelines sent to them, and that happens when they're registering for the patient guideline webinar. I talked a little bit about our free print copy distribution. This is a screenshot from our Facebook page or our LinkedIn page. We have it on both. We try to spread the word as much as possible. Again, these go extremely quickly. So if you see this pop up, jump on it right away. Order your copy because they are limited in supply and they go quick. If you want to help share this information, please share on social media this opportunity for people to access these free patient guidelines. One thing we're extremely proud of is that we've worked very hard over the years to collaborate with other patient advocacy organizations. We started with contacting the patient advocacy organizations with our current patient guidelines back, I think it was 2014, and we've worked from there to really figure out how we can collaborate best with other patient advocacy organizations. There's many like-minded and like-missioned advocacy organizations out there, and they have welcomed us with open arms to collaborate with them. We have over 100 patient advocacy organizations with signed agreements with the NCCN Foundation to endorse our patient guidelines, as well as you can see here for head and neck cancer. We had 3 organizations that actually were interested in a deeper level of collaboration, and they actually helped to co-sponsor the patient guidelines and helping to, make sure that they are possible. And so they help give a little bit of funding to the overall cost of the patient guideline, and they get their logo on the front cover. And what I found is a lot of these organizations are using the NCCN Guidelines for Patients as one of their patient education tools. In NCCN, our niche is the guidelines. So for us to be able to do this and provide it for patient advocacy organizations has been very helpful in feedback from them. And it's also wonderful to highlight them and allow patients to know what wonderful things that those organizations have going on. It's just a great collaborative model. Patients can get the best information through the guidelines, and then they can get the best support and other programs that are available at all of those organizations. So you can see on this head and neck patient guideline, you'll see supported, in part by these organizations and endorsed by other organizations as well. And then individual support also comes in to the patient guidelines, as well as some support for industry. And they are acknowledged on the back, along with our patient advocate organizations. We're very careful in that the adaptation process, which Dottie will cover in a few minutes, happens within NCCN. There's no outside influence, of course, because the content's coming from the clinical practice guidelines. But it's great to have these supporters, endorsing and really spreading the word about the patient guidelines and what we do. So we definitely want to thank our patient advocacy sponsors and endorsers. We've had many of the organizations that we work with renew their agreements with us for 2019 and 2020. We hope to continue that process and continue working with all of the organizations to co-promote each other's programs. We've also had great support from our corporate supporters. This is a list from 2019 and 2020. If your company is not on this list, we want to get you on this list. So please, contact us, and we'll definitely talk to you about options for supporting new and updated patient guidelines for patients. And I'm going to conclude and pass the baton over to Dottie to talk about our patient guideline process. Thank you.
Great, terrific. Thank you so much, Marcy. I'm so pleased to be here today and to review with everybody how we actually develop these guidelines. So I'm just going to start with a little background information. NCCN leads the advancement of cancer care by providing timely and relevant guidelines and content. So the guidelines, the NCCN Guidelines for Patients, are a derivative product based on the NCCN Clinical Practice Guidelines. As Bob mentioned, there are 59 panels that update 77 guidelines consisting of more than 201 algorithms. There are more than 1,530 panel members that participate in the NCCN Guidelines program. So this slide just represents the development process of our NCCN Clinical Practice Guidelines in oncology. As you can see, and you probably are aware, the guidelines are updated at least annually. However, for many of the guidelines, there are also interim updates based on FDA approvals, expanded FDA indications, publications, presentations of data that have significant impact to clinical care. So the goal of the NCCN Guidelines for Patients is to effectively communicate the evidence-based recommendations in cancer care information clearly so that individuals understand it correctly. It is relevant at all points along the continuum of cancer care, from disease prevention and early detection through diagnosis, making treatment decisions, managing side effects, supportive care, and survivorship. This is an overview of the development process for the patient guidelines. I'll address each step as we go in further detail as we go along. But as mentioned previously, the patient guidelines are based on the clinical practice guidelines. Therefore, the very first step is to learn and understand the recommendations of these guidelines and to determine what content is important for patients. So the first step is our prep work. For new and updated patient guidelines, it is important for the medical writers to learn the information. They spend a great deal of time reading the algorithms and the discussion sections. They go to the source documents and read references if needed. And we are very fortunate to have a wonderful clinical information team and panelists that we can contact if we have any questions. For an existing patient guideline that is to be updated, they need to identify the changes. So as mentioned, some of the guidelines go through multiple interim versions and annual versions. So therefore, the medical writers have to obtain all the versions. They highlight new information, and that's in the current clinical practice guideline. And then they also must be very careful to note that any information that has been deleted or removed. So the medical writers start by they create an outline that will eventually be used as the table of contents. And they start this by providing the background information about the specific cancer type. They move into testing and treatment options, and it goes through and it builds the framework for the patient guidelines. The guides of the clinical, this is a slide that has a clinical practice guideline and how it appears in a patient version. So guides are table representations of the treatment pathways and other clinical information. Patients and caregivers, it's really important that they know and realize that they follow the same treatment pathways as their physician does. So there's the two different views. But for the patient guidelines, these guides are usually accompanied by additional text that further explains the recommendations. And then, in addition, images are used to educate the patients and to just add some visual interest to the guidelines. The information is further reinforced by our review sections and questions to ask. These are important tools for patients to utilize when discussing options with their medical team. We really hope that by providing these questions, it breaks like that awkwardness and allows patients to have real discussions about what is important to them and get the questions that they have answered by their physicians. So the second part in the development is applying health literacy principles. And this is important because health literacy is the ability to find, understand, and use this health information and services. Health literacy affects everyone regardless of race, ethnicity, gender, income, education level, or social status. And nearly 9 out of 10 people struggle to understand this. 3 out of 10 have no experience in the healthcare system, and 1 out of every 3 college-educated individuals have limited health literacy. And this results in sometimes, nurses, physicians, and care providers, they may overestimate the health literacy skills of their patients, and patients are often embarrassed and do not feel comfortable asking the questions. So it is so important for us to put this information into format that they can understand. So what do we do to ensure this? We apply the principles by providing information in a clear, logical, and easy-to-read format. Again, identifying information that patients need to know versus what is nice to know, and always using plain language, an active voice, a positive and conversational tone. Some key things are to avoid using capital letters, medical jargon, and numerical symbols. All terms in our patient guidelines are defined in a glossary as well as acronyms. And of course, as I mentioned, we use graphics and images to increase comprehension and recall. The purpose really of these guidelines is to provide the information, but also to encourage shared decision-making and patient engagement. Step 3, just like our clinical practice guidelines, our patient guidelines go under a medical review because words matter, and it is definitely possible when trying to simplify language, the true intent of the recommendation could be changed. Therefore, to ensure the accuracy of the patient guidelines, our multidisciplinary specialists and patient advocates from the panel are asked to review for accuracy and completeness and to provide feedback. We also have our specific design and layout. So design elements are just as important as actual words. It is important to use the appropriate font size. Our style guide uses at least a 12-point font for text. This is large enough for most readers to be able to see. And then headers and titles are 18-point, and they stand out for those individuals who are just scanning through a booklet and looking for specific sections of information. There is also color contrast and color blindness standards. Using color contrast standards helps user identify sections. So headings are bolder than the rest of the text. Pictures are ranged in size from large to small, and colors distinguish certain parts of the page. Readers can scan the page and look for the areas that jumped out at them. And looking at color contrast, the minimum threshold should be 4.5 to 1, and our headers are at 10.4 to 1. And then for color blindness, it's 8% for men and 5% for women, and we use a color contrast standard of 21 to 1. Graphics and images are added to the booklets to visually explain when words are not enough or to bring extra attention to specific recommendations or sections. We get our medical illustrations from licensed vendors, and we feel that that's important to invest in these because it just adds so much to the guidelines. Our guidelines are very easy to navigate. There is open space, white space, and photos that signify your navigational change going from one chapter to another. And we also have the use of breadcrumbs as another navigational feature. It is designed to reinforce where the reader is in the booklet. So they just follow at the top of the page, and it just follows that section's table of contents. So there's also a visual rhythm to the guidelines. As soon as you place more than one element on a page, you create a pattern, and the pattern is the basis of the rhythm. So rhythm can lead the user through the design. We establish a visual rhythm by keeping similar items in the same places throughout the book. Readers end up getting used to the patterns of placement, and then they don't have to search for so much information. And in addition, by keeping a very nice, steady rhythm, it minimizes the jumping while going across pages and reduces eye strain. So it allows users to actually be able to focus more on the content. Step 5, again, we go through a lot of review and revise. So we have a fabulous senior copy editor who, this is just a sample of some of the general things that she checks for us. However, they go through a very comprehensive review. They are also sent to our advocacy groups and sponsors for review. And then we always have a final review by our medical writers and other departments such as our marketing and foundation and graphic design. So this is the internal review by the senior copy editor for quality assurance. Again, this is just pretty much a repeat of some of the general check items and then how she notes them for our patient medical writers to make the appropriate changes. And then we also continue involvement with health educators and panel members too. If there's any additional questions, we can always go back. And then lastly, we post our guidelines, and they get posted on the website and through the app, and as Marcy indicated, and we are always looking for feedback from our users. So there is an online survey. We also have an email address. If patients have questions, they can email us directly. And this is just some of the quotes that we got from users who completed our survey, and that they like the ease of using it, or knowing that the guidelines are current and that my treatment decisions are not based on old data. So that is pretty much the whole process, and I thank you for your time, and I really appreciate everybody, the leadership, the foundation, and especially the clinical information group that works so hard on these guidelines. And with that, I'll turn it over to Dr. Weijin Ko.
Thank you for this opportunity to share some background and insights on one of the initiatives that is supported by the NCCN Foundation, as outlined by Marcy, and that is the Young Investigator Awards program. So I would touch on these various thematic elements and expand on them in the subsequent slides relative to the Young Investigator program. The overarching goal of the Young Investigator Award program is to provide vital funding for many of the nation's next generation researchers and clinicians. And this actually happily intersects with the fact that these investigators who are nominated by the NCCN member institutions are highly selected and dedicated to advancing the science and seeking breakthroughs in cancer research. Now, the research focus of the program is purposefully broad. We don't want to quell innovation. Obviously, we would like proposals that advance the mission of NCCN, and that is to improve, as previously mentioned, the quality, effectiveness, and efficiency and accessibility of care. But we recognize this can take many forms. It could take the approach of improving evidence-based research in clinical treatment, basic science, implementation science such as health systems and delivery of care, evaluations into quality of life, and also patient education, things that touch upon the entire continuum of care for patients. The program structure is outlined as such. We would like to give each awardee a 2-year grant of $75,000 per year. This RFP is released only to NCCN member institutions, the 30 member institutions that Dr. Carlson mentioned. And each institution is only allowed to select one nomination. So you can see that there's a pre-selection process that already provides highly qualified and highly selected individuals. The NCC Oncology Research Program, once the awardees are selected, manages the selection process and oversees the project and provides mentoring and best practices to the awardees as it guides them through that 2-year process. As we discussed, the NCCN Foundation raises the funds to support the Young Investigator Award. The NCCN Oncology Research Program oversees the process once that award is made. The way this is done is that each institution provides typically a senior member of their staff to the Young Investigator Award Selection Review Committee. The grants are then evaluated and ranked using an NIH scoring mechanism. As I previously mentioned, these people are already pre-selected, and it's always difficult to exclude anyone. We would certainly like to have, there's much more awards that qualify if we had the funding to support them. And most importantly, what's been the impact of the Young Investigator Award program? This is now in its 10th year. More than $7.2 million have been awarded to date to 50 investigators. Research always published and presented at the NCCN annual conference. That is one of the requirements for the young investigators. And awardees have all contributed significant new knowledge, and many have become new leaders in the field of oncology. To give you an example of the broad range of topics that can be the basis of research, these are just some of the topics specifically from the last 3.5 years. It encompasses basic science, genomic profiling, for example, to clinical trials, to implementation science, such as understanding racial disparities, improving end-of-life care for cancer patients, using digital communication to support patient management with head and neck cancer, and using machine learning to see if we can improve early detection of cancer. So as I mentioned, these are very motivated investigators who come in with great ideas, and there are more ideas than we have funding for. The results of these investigations have been widely published. I list two that have been published in the New England Journal of Medicine, but they've also been published in other prominent journals, such as the International Journal of Radiation Oncology, Biology, and Physics, Oncology Nursing Forum, and of course our own journal, the Journal of the National Comprehensive Cancer Network. To put some faces to the awardees, I'd like to introduce you to two individuals that we feel that the awards made a big difference in their career development, and in turn, they have now become leaders in the field of oncology and are giving back. This is Crystal Denlinger, who received a Young Investigator Award in 2012, looking at guideline adherence in small cell cancer and colorectal cancer. She's now a leader in the field of GI oncology and is now the chair of our survivorship guidelines panel. A more recent awardee is Kemi Dahl, who's a GYN oncologist from the University of Washington. Particularly germane to some of the comments made by Dr. Carlson, she has evaluated the experiences of Black women in endometrial cancer in the United States and has gone on to seek additional funding to look at mechanisms that can overcome barriers to care related to racial and ethnic backgrounds. For the 2020 year, we have 5.5 awardees. I say 5.5 because there are 6 people here, but we only had funding sufficient to support 5.5. We would, as I've mentioned, like to support many more, but we're constrained only by the funding amount. But you can see all of these young investigators that we recognize will contribute to knowledge, the advancement of cancer care, and we certainly look forward to them becoming the future leaders of oncology. All of this is made possible through the generous support of people like you. You can see the supporters of the Young Investigator Awards in 2018, 19, and 2020. Several have been repeat donors and supporters, and for that we are extremely grateful. we certainly invite more people to join in this endeavor. And for those of you who have not previously contributed but are interested in it, this is some general information that we would like to issue the request for proposal by October of the year, anticipation that the Young Investigator programs and research projects will begin in July of the following year. You do have the ability to specify topic-specific awards. So, for example, one could specify that this young investigator focuses on lung cancer or ovarian cancer. So that is a possibility in your support. And certainly there will be information provided to you at the end of the slide set as to who to contact should you want more information or wish to have questions answered. And with that, I'm going to turn it over to Wendy for a question and answer session before Gary Weimiller closes this webinar.
Thank you, Wheaton. Okay. Thank you all for presenting today and for our participants for being here with us. And thank you for your questions that have come in already. If you have any more, please feel free to put them in the Q&A now. The first question we had, and I'll put this to Marcy, is any of the information for patients available in Spanish?
Great question. We would love it all to be in Spanish, but we need to raise the funds to be able to do that. But currently, we have the stomach cancer patient guideline translated into Spanish, as well as the kidney cancer guideline is translated into Spanish, knowing also that there are probably additional Spanish translations for those same patient guidelines that we should do just because of different dialects and things like that. So if you are interested in supporting Spanish translations, definitely let us know and we can get that done. Thank you.
Thanks, Marcy. Another question came in that would be particularly appropriate, I think, for Dr. Ko, if you're able to put your video back on.
Yeah, okay.
We have someone asking about if NCCN offers CME, CEU opportunities. I've proposed to our executive team that we should sponsor a CME, CEU, and are looking for an organization to provide accreditation.
So, NCCN does have a continuing education department that puts out accredited CE webinars and live programs. So there are certainly opportunities to support that. For example, we do have a series of webinars that are focused towards healthcare providers, pharmacists, and the like. We also put together programs related to our annual conference or hematologic oncology malignancy conference, where there's also additional forum that supports nurses and ATP. So yes, there is the possibility for an organization to support a CE program. And certainly if they contact us, we can put them in contact with Kristen Hansen and the rest of the CE group.
Yes, just if anyone would like further information or whoever asked this question, if you'd like to send me an email at rees, R-E-E-S, at nccn.org, I'd be happy to put you in touch with someone in that department. Another question that came in, and I'll put this to Dottie, is are drug brand names included in the patient guidelines?
I'm sorry, Wendy, could you repeat that question?
Absolutely. Are drug brand names included in the patient guidelines?
Yeah, so in our clinical practice guidelines, they only use generic names, but in several of our patient guidelines, we include both the generic and brand names, usually in a table, just so patients know that they are still receiving the same care and the same treatment. They may not recognize the generic names. So the patient guidelines definitely list those.
Thank you. And we had a question. This was actually from the last session of the supporter forum, but I think it bears repeating, and this would be appropriate for Dr. Coe or Dr. Carlson. And the question that came in was, patients have asked, what leverage do I have with the NCCN guidelines if my oncologist is not following the guidelines and I know it?
I can take a stab at it, and I don't know if Dr. Carlson is there. So we recognize, number one, that the guidelines are that they're not absolute. They provide appropriate concepts, guidance for the vast majority of cases. So if there is something that a patient picks up that is not concordant with the guidelines, I think what this does is that it should empower the patient to ask, well, why is this not along guidelines? There may be very good reasons. There may be significant comorbidities or sensitivity to certain drug regimens or inability to tolerate, a procedure that otherwise would be done. I do think, however, if that the patient receives information that is not satisfactory and that what they perceive from the patient guidelines is different from what their oncologist is recommended, that would be a case where a second opinion would perhaps be appropriate. So I think the idea from the patient guidelines is not to say that is absolutely what should be done no matter what, but is to provide that context where the patients can engage with their care provider in a knowledgeable manner and make sure that the care provider explains to them to their satisfaction what is being proposed.
Thank you, Dr. Coe. I have another question for Dottie. There was a question about the clinical guidelines panel. How many panel members are on the clinical guidelines panel?
Oh, sure, that's a terrific question. So there are at least one member from every member institution. So we have 30 member institutions. So it's multidisciplinary specialties that consist that make up the panels, along with just about every treatment panel now also has a patient advocate representing. So ultimately it should be 31. In some special cases, if there is a specialty that where they need to bring on an extra person to discuss stuff, sometimes it even exceeds 31.
Thank you so much, Dottie. Marcy, there were a few that came in that you might be able to help us with, which dealt with distribution and also linking to the patient guidelines. So both for pharmaceutical companies and advocacy groups, if they want to link to them, and also a little more about the distribution opportunities.
Sure, absolutely. So for permission, we do get a lot of requests from hospitals, from patient advocate organizations, and from industry that want to help with distribution. If a nonprofit, one of our nonprofit advocacy organizations or a nonprofit hospital wants to help distribute or to link to the patient guidelines, they actually can do that for free. They don't have to, they have to get permission from us, but it is a free permission, and we can work with them to deliver them high-res PDFs so they can do their own printing, or like I said, they could just link to it. Our collaborating advocacy organizations all agree that they will put a link on their website to the patient guidelines as well, so that definitely helps with distribution. If it's a for-profit company that wants to distribute or to link to the patient guidelines, they can actually put a request into our website in our permissions portal, or they can contact me as well. There is a licensing fee for them to be able to link to more than just the landing page of the patient guidelines, if they want to link to the specific patient guideline, or if they want to help with distribution. So we have worked with many companies to distribute their own copies into the field of the patient guideline of their choice, the one that they would like to support. And we've also worked with them to also distribute print copy, not just through our website, like I talked about earlier, but also patient advocacy organizations are always looking for free print copies as well to distribute through their organization. So they can also help deliver batches of print copies to the advocate organizations or to hospitals and things like that too. So there's lots of different opportunities to help with distribution, and we can work with you on what might work best for your organization or company.
Thanks, Marcy. Another question just came in for you as well, which is, does NCCN Foundation work with patient advocacy groups outside of the United States?
Good question, and yes, we do. We do have an NCCN global team that we can work with as well, but we have been contacted by organizations throughout the world to collaborate in some way on the patient guidelines. And I mentioned earlier about the large uptake of patient guideline viewership from Russia, and that really started through a physician, an oncologist in Russia, who found that patients in Russia were using all kinds of home remedies and awful things like bleach and non-recommended things, other supplements and things like that, to help cure or take care of their cancer. And so he wanted to get credible information out there and called and contacted us, and he's working with many organizations, advocacy organizations in Russia, to provide that information. I think we've done 10 translations or something like that so far. So yes, we work with global organizations, Save Your Skin Foundation in Canada. We just had a call with them this week. They endorse our patient guidelines and love to work with us as well. So we do work with organizations all around the world. And again, they can contact myself, or they can also contact our global team, and we can coordinate with them on patient guidelines as well.
Thank you so much, Marcy. I think we only have time for probably one more question, and I think we'll end with one for Dr. Carlson, if you're able to put your video back on.
I'm with you.
Okay. The question is, Dr. Carlson, what is your opinion of the true impact of COVID-19 will have on oncology patients and providers? And what do you see as NCCN's role in helping patients and providers address these issues?
That's a big question. Well, COVID-19, the pandemic, it's affected every aspect of medicine. And it will continue to, I think, affect every aspect of medicine, including oncology care, for the foreseeable future. I think at least through 2020 and likely well into 2021. Potentially even beyond that. And the dimensions that the COVID pandemic is impacting oncology care specifically are multiple. Patients are often fearful to go into facilities for cancer screening. And so we will see delays in diagnosis, and that will ultimately affect mortality, survival rates for many, but not all cancers. The treatment in terms of inpatient care that's required is often being delayed because, again, patients are quite anxious about contracting COVID. And what we have found at our own member institutions is that, with experience, they become actually very effective at controlling COVID infections in a hospital and in the clinic setting. And so, one of our challenges is to regain the trust of the patients, to be able to reassure patients that they will do fine and don't really have an increased risk of developing COVID-19 should they go to facilities for anti-cancer treatment. Another dimension that we're seeing that has been affected tremendously and continues to be is that of clinical research. Clinical and translational research essentially effectively has come to a halt in the U.S. And in most parts of the world, for that matter, and that's because of the diversion of resources to COVID-19 control. It's because, again, of the challenges of doing research with the telemedicine or remote management of patients that are undergoing complicated and often quite toxic therapies. And it's all of those things. And then there's a whole other dimension that may also impact us for the next 20 or 30 years, and that is it's impacting the ability to do training of new healthcare providers across the board. Nursing, pharmacists, social workers, physicians. All of those training programs are being impacted. Some of them are not allowing trainees to participate in the active care because they're concerned about the trainees becoming infected. And so much of what the trainees that are further along in their training are doing is they're being diverted to take care of COVID-19 patients. COVID-19 patients absolutely deserve care. They absolutely deserve care. But in order to be able to deliver that care, it does require that the resources be transitioned from other parts of medicine. And we're going to suffer from that for a long time.
Thank you, Dr. Carlson. Yeah, so we'll end on that sobering note. But Dr. Carlson, maybe you could expand a little bit about how NCCN will have a role in the future and in some of the issues that you brought up.
Well, NCCN is absolutely committed to assuring the best care for oncology patients that we can facilitate and can provide. Our centers have been leaders in developing strategies for cancer care in the midst of the COVID-19 pandemic, and for prioritizing that care. Where, if you have limited resources, where should you apply them to have the biggest positive impact on the oncology of patient community. We also, are developing strategies and best practices for, how do you keep your cancer center COVID-free? How do you protect your staff? What systems do you put in place in terms of screening for COVID infection for patients who are entering the facility? How do you manage and control those aspects? And again, hopefully those will have large impacts downstream as patients become more comfortable and confident that we can actually do that successfully. I think we can now, but I think we have a ways to go to convince the patient community that we can actually, for the most part, if not completely, accomplish that. The research enterprise is going to take a lot of effort to jumpstart. There's federal legislation currently that is actually devoted, major parts of it are devoted to, refunding the clinical research programs in the United States, including oncology, including cancer. And that will hopefully allow the researchers, from the basic science researchers, translational researchers, clinical researchers, to begin to catch up to where they could have been had the pandemic never happened. But it's a huge impact, and again, the impact of COVID-19 extends beyond COVID-19. It's really negatively impacting pretty much all aspects of healthcare globally at the time. So it's a huge problem.
Thank you so much. We had a couple questions come in. I think we have a few minutes. I'll just put some of these to our panelists as well before we head to our close. Dottie, there was a question that came in. Do the patient-friendly guidelines include plain language information regarding clinical trials?
Hi, yes, they do. There is a section on clinical trials in all of our booklets. And just recently that we have taken another look at that section, and we'll be updating it to make it even more improved for future books.
Wonderful. There's also one that came in, Dr. Ko, on the Young Investigator Award. Is there a list by area of interest of young investigators? For example, sarcoma and the role of inflammation, or by cellular mechanism, for example, Hippo pathway. I think that's how you say that.
So, is there a list? Well, each young investigator comes with a proposal. So we obviously have a list of all the areas of interest. And I don't know if this is answering the question. Has someone come in and said that they specifically want to study sarcoma? I have not seen that. But on the other hand, if a funder says, we would like a young investigator, we would fund an award that looks at someone who has particular interest in, sarcomas or pathobiology or treatment of sarcomas, that can certainly steer an investigator proposal in that direction.
Great. Thank you so much, Dr. Ko. Okay. Before Gary gives his closing remarks, please note that upon leaving the meeting today, you'll be directed to SurveyMonkey for a brief survey. We would appreciate your feedback so we can improve future programs, and we hope to have more programs like this in the future. We will also be emailing you in the next few weeks with a recording of the event and an invitation to discuss collaboration if you are interested. In the meantime, Marcy's contact information and my contact information are on the screen. We're happy to address any other questions you might have or information you may need. Thank you all so much for joining us today. And thank you, Gary, in advance for your closing remarks. I'll pass it over to Gary now.
Thank you, Wendy. First off, I would like to thank everybody for being with us today and for their attendance. As you can see on a number of these slides, the foundation is advertising that it's celebrating its 10th anniversary, and did want to not only thank you for your presence today, but also thank you for your support over the years. Without all of you and the support that you've provided, the foundation would not be where it is today and be able to do the good work that it does. So I really appreciate all the support that you've provided to us. If you've enjoyed today's program, I'd like to just take a minute to talk to you about a few of the other NCCN programs that are coming up, as well as some of the tools that we have available to individuals free of charge through the NCCN website. Our ever popular policy summits are always well attended. We have a greater opportunity now that we're doing these as live webinars to actually have more attendees than we've been able to have in the past, because we're not limited to the confines of our meeting space. So our next policy summit is available for registration now, and it's September 9th, and it will be talking about innovative solutions to drive down healthcare costs and their implications for access to high quality cancer care. In addition, we always have a very popular patient advocacy summit in December, and this year is no exception, although it will be a live webinar again. That will be occurring on December 10th, and it will be Cancer Across the Lifespan. This is also well attended, and registration will be open for this one very soon. In addition, our NCCN Academy for Excellence in Leadership in Oncology is a popular program. It's been offered in the past not only to our corporate council members, but also open to others in the pharmaceutical and biotech industry for those who want to learn more about NCCN and have an opportunity to hear from our guidelines panel experts in how they develop guidelines and what goes into the process and how pharma can participate in that process. So this next program is scheduled for Tuesday, October 6th, and registration is open now for this program. Likewise, we have an academy on the global side that deals with our industry partners who have global interests. We talk about the NCCN Global Program and what we're doing internationally. This academy, again, is a virtual academy and will be scheduled, is scheduled for September 16th, and enrollment is available now on our website. And you heard earlier in the program about some of the mobile applications that we have available. Apps are available for our clinical guidelines, which now include copies of the patient guidelines as well. We have a separate patient guideline app, and we have the NCCN Reimbursement Resource Room app, which is also available either on the NCCN website, or you can go to the app stores and download them directly from there. And lastly, just wanted to talk a little bit about the Virtual Reimbursement Resource Room. This is a resource that's available for patients, caregivers, for providers to be able to help direct patients who are receiving care to resources that are available to help them with reimbursement for costs of treatments. And this is available on our website. So that concludes our program for today. I'd like to again thank everybody for attending. I'd also like to thank all of our speakers for their presentations and their participation, and in particular to Marcy and Wendy for their careful diligence in organizing these programs. We hope to hear from all of you again soon. Please stay in touch, and hope to see you at one of our upcoming seminars. And that will conclude our program for today. Thank you.